Iron is one of the most important minerals in our bodies. It plays a major role in the formation and function of many of our systems, including the formation of hemoglobin, which perhaps is one of the most important functions of iron. It's also important for the growth and development. And a lot of hormones require iron to be synthesized. So we find most of our iron in the blood in the form of hemoglobin. And it makes sense that people who are constantly bleeding are at risk of developing iron deficiency. So menstruating women are at risk of developing iron deficiency. And this is also true for pregnant patients, as the developing fetus grows and consumes large amounts of iron. If a patient develops iron deficiency, this is called iron deficiency anemia. And the symptoms include fatigue and weakness, also lightheadedness, confusion or loss of concentration, high sensitivity to cold, shortness of breath, rapid heartbeat or arrhythmia and tachyarrhythmia, pale skin, hair loss and brittle nails, and pica, which is craving non-food items such as ice or sand. To eliminate the symptoms of iron deficiency anemia, the patient should eat about 150 to 200 milligrams of iron every day. And of course, the blood levels should be checked periodically. The people who are especially at risk of developing iron deficiency anemia include, as we said, pregnant patients, menstruating women, vegans, and individuals with chronic kidney disease, especially those who are on dialysis. We have two forms of iron that we can consume from certain foods, and this includes heme or non-heme iron. Heme iron is better for absorption, and you will need smaller and smaller doses to reach the sufficient levels. Non-heme iron is harder to be absorbed, and these are the sources. The recommended daily intake for iron includes 8 mg a day for men and 18 mg to 27 mg a day for women. This increases if the patient was pregnant or lactating. The symptoms of iron toxicity includes constipation, abdominal pain, nausea and vomiting. Use the link below to get access to the full Essential Vitamins and Minerals course. In this course, we will talk about all the vitamins, the minerals, their important functions, and deficiency symptoms. At the end of the course, you will be an expert in vitamins and essential minerals, as the course covers everything that you need to know.